Historically, many of us believed that MGD looked like this picture: red eyelids that were inflamed. More recently, it's been described to not always be so obvious. If the disease is called Meibomian gland dysfunction, shouldn't we look to function to be our signal for whether the patient has the condition or not? Corbin Blackie revealed that a patient needs about 6 glands to be functional before they become symptomatic. We looked into this a little closer in our practice and revealed that 78% of our dry eye patients had 6 or fewer functioning glands. As such, we've begun looking very closely at both our dry eye patients, but also at our patients who are asymptomatic. We use a grading scale based off of Corbin Blackie's work to dictate our level of treatment. If with minor pressure or calibrated Meibomian gland expression, we see 6 or fewer glands flowing, these patients will either be symptomatic or are about to become symptomatic. We record the number of flowing glands, then treat them with thermal pulsation, and then monitor the improvement of number of flowing glands at their follow-up visits, typically 8 to 12 weeks later. If they have between 7 and 10 glands that are yielding liquid secretion, we proceed with caution, making sure that we're preserving the flowing glands that they still have. If the patient has significant amounts of atrophy, as observed with meibography, we may elect thermal pulsation. However, oftentimes we monitor these patients closely to ensure that additional glands are not becoming obstructed. We record the number of glands that are functional and treat them with 10 minutes of warm compress daily and lid hygiene for 2 weeks. Regardless of their symptoms, if the patient's glands do not show improvement, we'll encourage them to do thermal pulsation to open the plugged glands. If the patient has 10 or more functional glands, they're in the green zone and are ideal. But depending on their risk factors like blepharitis, gland dropout, concomitant LFU dry eye, etc., we'll use preventative in-office ocular hygiene, at-home ocular hygiene, and/or warm compresses. Remember that MGD is dysfunction. Glands that are not flowing are dysfunctional. If it's fewer than 6, treat and follow up to ensure function is returned. If it's between 7 and 10 glands, monitor and track closely. If it's 10 or more, rest easy with a watchful eye. For Dave Kading and Mila Brujic,
we want to thank you for joining us for this episode of Clinical Insight.